Have you been injured, told you have a disc herniation, and don't know what to do next? Don't worry, you're not alone. Hi, this is Dr. Matthew Collins. I am a chiropractor. I am board certified in rehabilitation, fellowship trained in primary spine care, and I've been managing patients with disc herniations for decades. I want to remind you that this brief video is for informational and educational purposes only. It does not replace medical or chiropractic advice, does not replace diagnosis, does not replace treatment, and is not a substitute for self-care. Today, we're going to discuss part 4 of a 4-part series. And this one is self-care and long-term results, sometimes called prognosis, with painful disc herniations. I'm actually going to start with the prognosis. Here's the challenge that most people face with a disc herniation. I'm going to use one of my models. The disc, as you can see here, is white. Muscle back here is red, and here's a red, inflamed joint. Now, while this is not exactly correct to the human body, it does illustrate a very, very important principle. Number one, the discs don't have a good blood supply. Discs have a good blood supply that lasts through the growth phase of a human being, but by the time you're in your mid-20s, for the most part, the blood supply is pretty much gone. Anything that has a poor blood supply does not repair quite as well. Muscles are nice and red, they have a plump blood supply, and so those tend to repair a lot faster. So a disc, you can do everything right. You can see the best doctors, you can do the right care, and sometimes it just doesn't work out, and that's unfortunate. Other times you can do everything wrong, cheat the system, cheat life, so to speak, and get away with it and recover. Discs are very fickle, and it takes an astute clinician and patient and cooperation between the two to make recovery. For the most part, in the adult, when there's a disc herniation, you're going to see the need for treatment and self-care 3 to 6 months on the short end, and sometimes it can be up to a year or more on the long end. And like I said, unfortunately, sometimes even with doing the right care, the right self-care, the right nutrition, some of these discs never repair fully. They continue to grumble, and sometimes they even spontaneously re-herniate over again, end up requiring surgery. However, I don't want to be dismal, but I have to be honest with you. So, what can you do? No matter which doctor you see, whether it's myself, whether it's a fellow chiropractor, whether it's a surgeon, whatever it is that you see, there is something that you have to do on your end. You can't see a provider for a few minutes per week and have that offset everything that you do on your end. So let's talk about that. In the initial phase, when you're injured, there usually is a lot of pain and a lot of inflammation. The disc becomes pressurized, putting pressure on the disc, such as that, where it goes up and down when you sit. The disc can experience compression factors between 10 to 11 times what it normally would if you're standing. So one of the most common things that you can do is basically avoid sitting. Sitting provokes the disc. The other thing you have to avoid doing is you have to avoid doing different motions that are painful. No two patients are the same, but if there's a motion that's painful, no pain, no gain is fine if you're training for the Olympics. When you've got a disc injury, you're not in the Olympics. You need to listen to your body in the early stages. You need to avoid crossing into the pain barrier to provoking it. Many times patients experience the 10-minute rule. They can't sit for longer than 10 minutes. They can't stand for longer than 10 minutes. They can't walk for longer than 10 minutes. It's unfortunate, but that's what it is. So you need to honor that. You also need to take care of the inflammation that's surrounding that. You can be doing nutritional anti-inflammatories. You can be doing some icing. Your provider should show you how to do that. The other thing you want to avoid doing is what was called coupled motions. Let me explain. The mechanism that can oftentimes hurt and injure a disc or re-aggravate it is when you combine compression with side bending. So let me show you this. So this is like looking at you from behind, compression or my fingers pressing down, side bending, rear side bend to the side, and then rotation. Let me give you an example of that. You go grocery shopping. From the grocery cart, you pick up a sack of heavy groceries, compression. because you got the weight in front of you. You then go to put it in the trunk that's lower than you. So now you side bend and you move it off to the side. There's the rotation. Those movements right there are pretty much ones you want to avoid because they can be very painful. So as you go through the recovery process, you handle the inflammation, you start to move out of the pain and the inflammation, then you start to move into what's called kind of the rehabilitative or the stabilizing process. Now what happens is you don't have as many symptoms, but your recovery is rather tenuous because you don't have pain as a barrier to limit you. So I went and I picked up my model. So if you take a look at this one here, you see how this joint over here is not red, it's not inflamed, but this one is. Oftentimes we see where there's a disc herniation, the disc will be on one side versus the other, and then that joint itself can also become painful. So you tend to avoid moving into that joint, so you're only moving in one direction. However, once that joint and that disc become less painful, the natural tendency is to want to move into that direction. But you have to realize that it's avascular, meaning like poor blood supply. The scarring is not very robust. It is not very stable at that point. And even though you don't have pain to limit you, you can still tear the tear or re-tear the tear. So you do have to be careful. After a while, you start to move into what's kind of called the maturity stage. Discs repair with scar tissue. They don't repair with original tissue. You don't get original disc tissue there, unfortunately. It's kind of like wood filler, kind of like a scar tissue plug. So you have to wait for that scar tissue to adhere to the surrounding tissues. You have to wait for it to reintegrate into the different forces of your day-to-day activities so that way it can stand up to that. And then as time goes on, you would expect to see that a patient can do more and more activity with less and less discomfort. After it's all done and after you reach what's called maximum therapeutic benefit, the question is, will it come back? That's a very, very common question. I hear that almost 100% of the time. And the answer is we don't know. We don't have a crystal ball. However, because discs repair with scar tissue and they don't repair with original tissue, it's weaker and stiffer. It is technically now a little bit more or a lot more brittle than it was before. So yes, it can happen. Also, that disc doesn't move the way that it used to. Secondly, that not moving the way that it used to can compromise your mechanics. So you need to sometimes exercise and move around that. And then thirdly, if there's any disc space collapse, as that disc is herniated, it's scarred over, pain's gone away, sometimes the joints in the back continue to be symptomatic. That is a common side effect, a long-term side effect that I sometimes see with my patients with disc herniations. Sometimes those patients, it's like kidney disease or heart disease. There just needs to be some sort of ongoing management. We don't recommend that for all of our patients. It's unique to the individual patient. But some patients, regrettably, they do need some ongoing periodic management. They also need to do periodic home exercises, different things to keep that disc healthy and to keep the back functioning again. I hope this series has been helpful for you. I hope it's given you a picture. I hope it's been optimistic. And I hope that you find a provider that is able to take care of you. So remember, this 4-part series where we're talking about the spine, the motion unit, and disc herniations, this is not designed to replace good medical or chiropractic advice, diagnosis, or home care recommendations. You have a lot of opportunities to watch videos, and I'm honored that you chose mine. I hope that this has empowered you, this has helped you, and be blessed until the next time we meet again this way.